Have you been taking amlodipine for years? Here's what long-term data shows. In one major follow-up study that tracked patients for 5 years, researchers found that amlodipine cut the risk of death in people with heart failure by about a third compared to those who didn't take it. That's a big reason doctors keep prescribing it. In fact, in the United States alone, more than 70 million prescriptions for amlodipine are written every year. But here's the part that rarely gets discussed. Even with those benefits, long-term use brings its own risks. After 5 years or more, certain side effects can build up in ways patients don't always expect, and we'll break it down today. Before we get started, one quick note. This video is for educational purposes only. It is not medical advice. Never change your medication without first talking to your doctor. Stick around, because by the end of this video, you'll know which long-term side effects become more common after years on amlodipine, why they happen inside your body, and what warning signs you should never ignore. So let's begin with the number one issue doctors see over time: swelling in the feet and ankles. One of the most visible long-term side effects of amlodipine is chronic swelling. This usually happens in the ankles, feet, and sometimes the lower legs. Doctors call it peripheral edema. Here's why it occurs. Amlodipine relaxes small arteries. This lowers blood pressure. But the veins, which return blood to the heart, do not widen as much. That imbalance increases pressure in the tiny blood vessels of the lower body. Fluid seeps out into the tissues. The result is swelling that often gets worse by evening. Clinical studies confirm this effect. Up to 30% of patients on higher doses report swelling. With long-term use, the swelling may become persistent. This can happen even if heart and kidney function remain normal. Patients often describe simple signs. Shoes feel tighter at night. Socks leave deep marks. Ankles look puffy. In severe cases, swelling moves up the legs and makes walking harder. Older adults face added risks. Poor circulation and fragile skin make the problem more serious. This increases the chance of infection or skin breakdown. Doctors may adjust treatment to help. Sometimes the dose is lowered. Sometimes amlodipine is combined with another drug, like an ACE inhibitor or an ARB. These combinations balance pressure between arteries and veins, reducing swelling. Leg elevation, less salt, or compression stockings may also help, but usually only partly. It is also important to check for other causes. Heart failure, kidney disease, or liver disease can also cause swelling. Those conditions often bring extra symptoms, like shortness of breath or sudden weight gain. Amlodipine-related edema usually does not. Still, persistent swelling should never be ignored. If you notice this change after months or years on amlodipine, talk with your doctor. A small adjustment may bring relief without losing the benefits of treatment. Another common long-term side effect of amlodipine is flushing. This means sudden warmth or redness of the face, neck, or upper chest. Some patients also describe a mild burning or tingling feeling. Why does this happen? Amlodipine widens small blood vessels near the skin. When those vessels open, more blood flows to the surface. The skin looks red, and the face feels hot. Studies show this side effect in 5 to 10% of patients. It often appears soon after starting treatment, but it can also continue in long-term use. For most people, flushing is mild. It may last only minutes or an hour, but in others, it happens daily and becomes bothersome. Patients usually describe it as a warm rush across the cheeks, redness that others can notice, sweating that makes social situations uncomfortable. Older adults may be more sensitive. Their skin blood vessels respond more strongly to amlodipine. Some also confuse flushing with menopausal hot flashes or allergic reactions. Flushing may look dramatic, but in most cases, it is not harmful. It does not damage the skin or the organs. The main issue is discomfort, not danger. Doctors sometimes manage this by lowering the dose. Taking the medication at night may also reduce daytime flushing. Avoiding alcohol, spicy food, and hot drinks can help, since these can trigger episodes. If flushing appears with other symptoms like rash, itching, or swelling of the lips and throat, seek medical attention. That pattern could suggest an allergic reaction, which is rare but more serious. For most patients, flushing is only a nuisance. Still, if it is persistent or severe, your doctor can adjust your treatment plan. But not all side effects are visible. Some affect the liver and kidneys silently over time. Amlodipine does more than just lower blood pressure. By keeping blood pressure under control, it also protects vital organs. The kidneys are especially sensitive to high pressure. When blood pressure is uncontrolled, the tiny filters inside the kidneys are damaged. Over time, this leads to chronic kidney disease. By lowering blood pressure, amlodipine reduces that stress. The Mayo Clinic notes this as one of the long-term benefits of proper treatment. The liver is also involved. Amlodipine is processed or metabolized in the liver before it leaves the body. In most patients, this happens smoothly, with no problems at all. But there are important details to keep in mind. Some patients on long-term therapy develop mild changes in liver enzymes. This shows up only on blood tests. Patients often feel fine, but the numbers are higher than normal. That is why doctors recommend periodic liver function tests if you are on amlodipine for years. The kidneys also deserve monitoring. Even though amlodipine itself rarely harms the kidneys directly, patients with high blood pressure often already have kidney strain. Regular blood tests for creatinine and eGFR help track kidney health. So what are the actual risks? Current data show no strong evidence that amlodipine causes chronic liver failure or kidney failure on its own. Most studies, including long-term follow-up, do not link the drug to lasting organ damage. The main concern is hidden enzyme elevations in the liver or worsening kidney numbers in patients who already have disease. Older adults are more vulnerable. They often take multiple medications, some of which also affect the liver and kidneys. Drug interactions may increase the burden. That is why routine monitoring is important, even if you feel well. Patients should watch for warning signs: yellowing of the skin or eyes, unexplained fatigue, dark urine, persistent nausea. These can suggest a liver problem. For the kidneys, look for swelling, changes in urination, or sudden weight gain. If these appear, medical review is needed right away. In summary, amlodipine offers clear protection for the kidneys by lowering blood pressure. But since the liver processes the drug and the kidneys carry part of the load, regular testing is wise. Doctors usually order blood work once or twice a year for long-term users. This ensures the medication stays safe and any silent changes are caught early. Not all side effects of amlodipine show up in the legs or skin. Some appear in the mouth or in the nervous system. One rare but documented reaction is gum hypertrophy. This means the gums slowly become enlarged and swollen. It happens because the drug triggers changes in gum tissue cells. Extra connective tissue grows around the teeth. The gums look thick, sometimes uneven, and may bleed when brushing. Studies estimate this occurs in about 2% of patients. It is more common with long-term use. The good news is that it often improves once the drug is stopped or changed. Good oral hygiene, regular dental visits, and professional cleaning can reduce the severity. Dentists are usually the first to notice this change. Beyond the gums, amlodipine can sometimes affect the nervous system. These reactions are uncommon, but they have been reported. Some patients describe trouble sleeping or mild mood changes. Others report fatigue, restlessness, or, rarely, depression. Large trials, such as the All-Hat study with 18 years of follow-up, found no increased risk of major psychiatric problems in people using amlodipine. That means the nervous system effects are usually mild, reversible, and not dangerous for most patients. Older adults may be more sensitive. Poor sleep or low mood can overlap with aging or other medical conditions. This makes it harder to know if amlodipine is the main cause. In practice, if gum overgrowth appears, or if sleep and mood problems worsen, patients should inform both their doctor and their dentist. A dose adjustment or a switch to another blood pressure drug often solves the problem. So while gum hypertrophy and neurological effects are rare, they matter because they affect daily comfort and quality of life, not just lab results or numbers on a chart. Most people who take amlodipine tolerate it well. But like any long-term medication, there are rare but serious risks. One concern is the heart itself. In very uncommon cases, amlodipine can be linked to worsening angina or even a heart attack when therapy is first started or the dose is increased. This happens because sudden blood vessel relaxation may temporarily shift blood flow in patients with severe coronary artery disease. Though rare, doctors monitor closely in the first weeks of treatment. Another risk is acute heart failure. This is not common, but in patients with weak heart muscle, too much vessel dilation can sometimes lower blood pressure suddenly and strain the heart. Severe low blood pressure is also possible, though unusual. Most patients only see a gentle reduction. But in frail adults or those on multiple blood pressure drugs, the drop can be stronger. This may cause dizziness, fainting, or falls. Other very rare events include allergic reactions, chest pain flare-ups, or unusual changes in heart rhythm. These are listed in safety data from sources such as drugs.com and clinical trial reports. The mechanism is straightforward. Amlodipine relaxes blood vessels. For most people, this is beneficial. But if the body cannot adjust fast enough, the heart and circulation may react in unexpected ways. That is why ongoing monitoring is essential. Regular checkups, reporting new symptoms, and adjusting the treatment plan help prevent these rare complications. For most patients, amlodipine remains a safe and effective long-term choice. But knowing these rare risks ensures that if warning signs appear, action can be taken quickly. Amlodipine offers proven benefits. It lowers blood pressure, protects the heart, and reduces the risk of death in long-term trials. But with those benefits come trade-offs. Swelling, gum changes, and other side effects become more likely as the years go by. The key is balance. Stay on the medication for its cardiovascular protection. If you've taken amlodipine, stay alert for changes in the body. These are the side effects. Regular follow-up with your doctor share with your doctor, both safe and effective. If you found this breakdown helpful, if you've taken amlodipine, give the video a like. These are the side effects. Don't forget to subscribe for more and share with your doctor. Evidence-based deep dives. If you found this breakdown helpful every day, give the video a like. Check the video description. And don't forget to subscribe to sources for more clear, including Mayo evidence-based clinical trials into the medicines you use and the all-hat study. Check the video description for full links to sources PubMed, including Mayo drugs.com, clinicaltrials.gov, and the all-hat disclaimer. We've also included references for educational purposes only. Drugs.com. It is not and very well health. Do not stop or change any medication without talking to your educational purposes only. Always work with your doctor to make the best decision for your health. Or change any medication without talking to your own healthcare provider. Always work with your doctor to make the best decision for your health.